Every day, millions of people take medications to relieve bladder problems, allergies, depression, and insomnia. These medications are often considered safe, routine even, but growing evidence suggests that some of these common drugs might carry a hidden cost, one that affects the most sacred part of our being, the human mind. Today, we explore the link between anticholinergic medications and dementia. Now, before we dive into these crucial points, let me be crystal clear. This video is for informational and educational purposes only. Do not, under any circumstances, make changes to your medication regimen or lifestyle without discussing it with your doctor first. This information is meant to empower you to have informed conversations with your healthcare provider. 1. Understanding anticholinergics. First, let's understand what anticholinergic medications are. Anticholinergics are a class of drugs that block the action of a crucial neurotransmitter called acetylcholine. Acetylcholine plays a key role in many vital bodily functions, from muscle movement and regulating heart rate to facilitating digestion. Most importantly for our discussion, it's essential for memory, learning, and overall cognitive processes. Think of acetylcholine as a vital chemical messenger in your brain and body. By blocking acetylcholine's action, these drugs can effectively treat a variety of conditions, often by dampening overactive signals or calming certain bodily responses. For instance, oxybutynin and tolterodine are commonly prescribed for overactive bladder. They work by relaxing bladder muscles, which are largely controlled by acetylcholine, reducing the urgency and frequency of urination. Diphenhydramine, often found in Benadryl, is a widely used antihistamine for allergies and a common ingredient in over-the-counter sleep aids. It blocks acetylcholine receptors, leading to its sedating and drying effects. Amitriptyline is an older antidepressant, also used for nerve pain and migraine prevention. Its significant anticholinergic properties contribute to both its therapeutic effects and its side effect profile. Cyclobenzaprine is a muscle relaxant often prescribed for muscle spasms and acute musculoskeletal pain. It exerts some of its effects by blocking acetylcholine in the central nervous system. These are just a few prominent examples. The list of anticholinergic medications is extensive, including drugs from various therapeutic classes, often used for seemingly unrelated conditions. But what happens when you block acetylcholine in the brain, especially in older adults, whose brains are often more vulnerable to chemical imbalances? This is where the concern about cognitive impact arises. 2. The brain and acetylcholine. Acetylcholine is a neurotransmitter crucial for attention, learning, and memory. It's particularly concentrated in brain regions vital for cognitive function, such as the hippocampus and the cerebral cortex. This chemical messenger helps neurons communicate efficiently, forming new connections and consolidating memories. In fact, in Alzheimer's disease, the cholinergic system, the complex network of neurons and pathways that use acetylcholine as their primary neurotransmitter, is one of the first and most significantly affected systems to degenerate. This degeneration directly leads to many of Alzheimer's hallmark cognitive symptoms, like memory loss and confusion. It's not just that acetylcholine is helpful, it's absolutely essential for optimal brain function. Research has consistently shown that low levels of acetylcholine are directly correlated with impaired memory, reduced attention span, difficulty with executive functions, like planning and problem solving, and overall cognitive decline. Therefore, when you take a drug that actively blocks the function of acetylcholine, especially if you do so consistently over months or even years, you may be creating an environment within the brain that mimics or even accelerates the very processes that look a lot like dementia. This is the theoretical basis for the link. But is this theory supported by concrete scientific evidence? 3. The evidence emerges. In recent years, the theoretical link between anticholinergic medications and cognitive decline has moved from hypothesis to a growing body of robust scientific evidence. Multiple large-scale studies, utilizing diverse methodologies and patient populations, have investigated this crucial question. One pivotal study that brought widespread attention to this issue was published in the prestigious journal JAMA Internal Medicine in 2015. Researchers at the University of Washington followed a large cohort of over 3,400 older adults, aged 65 and older, for more than 7 years, meticulously tracking their medication use and cognitive status. The findings were stark. They discovered that people with higher cumulative use of anticholinergic drugs, meaning a greater total exposure over time, had a significantly increased risk of developing incident dementia, including Alzheimer's disease. Furthermore, the study revealed a clear dose-response relationship. The longer people use strong anticholinergic medications, and the higher the cumulative dose, the higher their risk. Critically, the researchers estimated that even just 3 years of consistent use of a strong anticholinergic medication could dramatically raise dementia risk, underscoring the long-term cumulative effect. These groundbreaking findings were not isolated. Other significant studies have echoed and reinforced these results. A 2019 study, published in the BMJ, involving a massive dataset from the UK, over 284,000 patients, found strikingly similar associations between anticholinergic medication use and an increased risk of dementia. This study helped to confirm the findings in an even larger and more diverse population. Meta-analyses, which are powerful research tools that combine data from multiple independent studies, have consistently confirmed the findings. These comprehensive reviews have solidified the understanding that the risk is both dose-dependent, higher doses or greater cumulative exposure confer greater risk, and that long-term use is the most significant factor, rather than isolated or short-term use. This accumulating body of evidence from multiple large, well-designed studies provides compelling support for the link, moving it beyond mere theoretical concern into a significant public health consideration. 4. How anticholinergics affect the brain. So how exactly do anticholinergic medications exert their detrimental effects on the brain? The mechanisms are thought to be multifaceted and involve several pathways that collectively contribute to cognitive decline and potentially accelerate neurodegeneration. Reduced neuroplasticity. Acetylcholine is a critical modulator of neuroplasticity, which is the brain's remarkable ability to reorganize itself by forming new neural connections throughout life. This is fundamental for learning, memory formation, and adapting to new experiences. By blocking acetylcholine, anticholinergic drugs essentially stifle this crucial process. When the brain's ability to form and strengthen connections is impaired, learning new information becomes harder, and the consolidation of memories is compromised. This directly impacts cognitive functions. Impact on amyloid plaques. Some emerging research suggests a more direct link to the pathological hallmarks of Alzheimer's disease. Studies, primarily in animal models and in vitro cell culture experiments, have indicated that chronic anticholinergic exposure might increase the production or accumulation of beta amyloid. Beta amyloid is the toxic protein that forms the characteristic plaques found in the brains of individuals with Alzheimer's. While more human research is needed to confirm this, it presents a concerning potential pathway by which these drugs could contribute to the underlying pathology of Alzheimer's. Brain atrophy. Perhaps one of the most alarming pieces of evidence comes from structural neuroimaging studies. MRI scans of individuals who consistently use anticholinergic medications have shown measurable smaller brain volumes, particularly in regions critical for memory like the hippocampus. The hippocampus is a seahorse-shaped structure deep within the brain that plays a major role in memory formation, spatial navigation, and learning. Shrinkage or atrophy in this area is a common feature of Alzheimer's disease and other forms of dementia. This structural change suggests that long-term anticholinergic use may be causing physical damage or accelerated aging of brain tissue. In essence, by blocking acetylcholine, these medications may not only acutely impair cognitive function, but could also accelerate the long-term aging process of the brain, potentially contributing to the development or acceleration of neurodegenerative conditions. 5. Who is most at risk? While anticholinergics can induce cognitive side effects at any age, think of the Benadryl hangover some people experience. The elderly are an especially vulnerable population. This heightened susceptibility stems from several physiological changes that occur with aging. Natural decline in acetylcholine. As we age, the brain's natural production and reserve of acetylcholine tend to decline. This is a normal part of the aging process. Therefore, taking drugs that further reduce this already diminished supply is like pouring water on a dying flame. The effects can be immediate and devastating. The brain has less cholinergic reserve to compensate for the blockade. Increased sensitivity to side effects. Older adults are generally more sensitive to the pharmacological effects of many medications due to changes in metabolism, kidney function, and blood-brain barrier integrity. This means a given dose of an anticholinergic drug can have a more pronounced effect in an older person compared to a younger one. Polypharmacy. Older adults are also more likely to be taking multiple medications, polypharmacy, for various chronic conditions. This increases the likelihood of being prescribed one or more anticholinergic drugs and also increases the risk of drug-drug interactions, potentially exacerbating cognitive side effects. The acute side effects of anticholinergic medications in older adults can be particularly problematic. Confusion. Even a single dose can cause disorientation and confusion, especially in those with pre-existing mild cognitive impairment. Falls, dizziness, impaired balance, and sedation increase the risk of falls, which can lead to serious injuries like hip fractures. Hallucinations. Some individuals, especially those who are more frail or sensitive, can experience visual or auditory hallucinations. Memory loss, acute memory impairment, difficulty recalling recent events, or trouble learning new information are common. These symptoms can sometimes be mistaken for the onset or worsening of dementia, when in fact, the medication itself is the root cause. This can lead to misdiagnosis and inappropriate treatment. Crucially, sometimes stopping the offending medication leads to a significant and even full recovery of cognitive function. However, the emerging research suggests that if the anticholinergic exposure is long-term and cumulative, the damage may, unfortunately, be permanent and contribute to true, irreversible dementia. This highlights the critical importance of careful medication review in older adults. 6. Not all anticholinergics are equal. It's critically important to understand that not all anticholinergic drugs are the same in terms of their potential cognitive impact. The degree to which a drug blocks acetylcholine varies significantly. Scientists and clinicians rank these medications by their anticholinergic burden, or anticholinergic activity. Drugs like diphenhydramine, Benadryl, and amitriptyline, Elavil, are considered to have high anticholinergic activity, and therefore pose the most significant risk to cognitive function. These drugs bind strongly to acetylcholine receptors and block them effectively. Other medications may have milder anticholinergic effects, or their primary mechanism of action is not anticholinergic, but they still possess some degree of this property as a side effect. To help clinicians assess a patient's cumulative exposure and potential risk, there's a tool called the Anticholinergic Cognitive Burden Scale, ACB. This scale assigns a numerical score to various medications based on their anticholinergic potency. Typically, medications are ranked as score of 1. Possible, some anticholinergic activity, but typically mild, at furosemide, warfarin. Score of 2, moderate, clinically relevant anticholinergic activity, e.g., cimetidine, nifedipine. Score of 3, high, potent anticholinergic effects, e.g., diphenhydramine, oxybutynin, amitriptyline. The scale also considers cumulative burden, meaning that taking multiple drugs with even a low anticholinergic score can add up to a significant overall burden. Clinicians can sum the ACB scores of all medications a patient is taking to get a total ACB score. The higher your ACB score, the higher your theoretical and observed dementia risk. This tool allows for a more nuanced assessment of risk beyond simply identifying if a drug is anticholinergic or not. 7. Hidden in plain sight. One of the biggest challenges in addressing this issue is the fact that many people, including healthcare providers, simply don't realize they're taking or prescribing an anticholinergic medication, especially when it comes to over-the-counter, OTC products. Think about common scenarios. Over-the-counter sleep aids. Many popular sleep aids, such as Tylenol PM, Zizquil, and Unisom, contain diphenhydramine or doxylamine, both of which are potent anticholinergics. Millions of older adults struggling with insomnia reach for these nightly without understanding their potential long-term cognitive consequences. They are often marketed as gentle and effective, leading consumers to believe they are entirely benign. Cold remedies. Many multi-symptom cold and flu medications also contain antihistamines like chlorpheniramine or diphenhydramine to help with sneezing and runny nose. Allergy drugs. While newer antihistamines like loratadine or cetirizine are generally non-anticholinergic in the brain, older generation antihistamines remain widely available and used. These products are readily available in pharmacies and supermarkets, often without a prescription, and they are generally marketed as safe and effective solutions for common ailments. However, safe in this context often refers to acute toxicity or immediate severe side effects, not necessarily long-term cognitive risk. For a fragile older brain, taking these drugs regularly can have a cumulative and significant impact that is often overlooked because of their widespread availability and perceived innocuousness. This makes patient and public education all the more vital. 8. What you can do. Given this compelling evidence, what proactive steps can you take to protect yourself or your loved ones from the potential cognitive risks associated with anticholinergic medications? Step 1. Conduct a thorough medication review with your healthcare provider. Schedule an appointment with your doctor, pharmacist, or a clinical pharmacologist specifically to review all medications you are taking. This includes prescription drugs, over-the-counter medications, supplements, and even herbal remedies. Crucially, ask your doctor or pharmacist this direct question: are any of my current medications, including my over-the-counter ones, considered anticholinergic? And if so, what is their anticholinergic burden? Don't assume they'll bring it up unless you ask. Bring a complete list of everything you take, including dosages and how often you take them. Step 2. Seek safer alternatives whenever possible. For many conditions traditionally treated with anticholinergics, there are often effective alternatives with little to no anticholinergic activity. For overactive bladder, newer medications like mirabegron, Myrbetriq, work through a different mechanism, beta-3 adrenergic agonist, and are not anticholinergic. Behavioral therapies, such as bladder training and pelvic floor exercises, can also be highly effective non-drug approaches. For allergies, second-generation antihistamines like loratadine, Claritin, cetirizine, Zyrtec, and fexofenadine, Allegra, are largely non-sedating and have minimal to no anticholinergic effects on the brain. For insomnia, non-pharmacological approaches should always be tried first, such as cognitive behavioral therapy for insomnia, CBTI, improving sleep hygiene, consistent sleep schedule, dark room, avoiding screens before bed, and relaxation techniques. If medication is necessary, talk to your doctor about options with a lower anticholinergic burden. For depression, nerve pain, many newer antidepressants, e.g. SSRIs, SNRIs, have significantly lower or no anticholinergic properties compared to older tricyclic antidepressants like amitriptyline. Work collaboratively with your doctor to explore these alternatives. Do not stop any prescribed medication without consulting your doctor first. Step 3. Be informed and advocate for your brain health. Educate yourself further about anticholinergic medications and their potential risks. The more you understand, the better equipped you will be to have informed discussions with your healthcare team. Remember that even seemingly small changes in long-term medication use can have profound and significant effects on brain health over time. Your proactive involvement in your medication management is crucial for protecting your cognitive vitality. 9. Hope in moving forward. The link between anticholinergic medications and dementia is now well documented by a growing body of scientific evidence. This understanding can certainly be concerning, particularly for those who have been taking these medications for years. However, it's crucial to emphasize that this doesn't mean everyone who's taken them is irrevocably doomed to develop dementia. The good news is that the human brain possesses a remarkable capacity for resilience and plasticity. If the use of offending anticholinergic medication is identified and stopped, especially in the earlier stages of cognitive decline, some individuals can experience a significant degree of cognitive recovery. Their memory, attention, and overall mental clarity may improve. This indicates that the damage is not always permanent, and the brain has the ability to bounce back once the inhibitory effect of these drugs is removed. The extent of recovery can vary depending on factors such as the duration and dose of exposure, individual brain health, and the presence of other contributing factors to cognitive decline. We are still learning a great deal about how the brain responds to these drugs, both acutely and chronically, and what interventions, if any, can further aid in cognitive healing. Research continues into methods to mitigate risk, identify vulnerable individuals, and develop even safer alternatives. In medicine, knowledge truly is power, and when it comes to protecting your most vital organ, your mind, understanding the impact of anticholinergic medications may be one of the most important things you can do. By being aware, asking informed questions, and working closely with your healthcare providers, you can make choices that safeguard your cognitive health for years to come. Your memory, your thoughts, your very sense of self, they deserve nothing less.